Employers are interested in performance, both from a competitive perspective to attract the best talents. I think two, to get the best out of that talent, and three might be the healthcare costs, right? I guess the traditional wellness programs range from health risk assessments to learn more about employee risk and their lifestyle, to lifestyle programs, smoking, weight loss, activity, exercise.
The Rand Corporation just completed a series of reports for the federal government where they did look into the efficacy of wellness programs. What they found is that it really varies depending on the type of the program. On average, these programs can save about $30 per member per month in health costs, but most of those savings are associated with certain kinds of wellness programs that include disease management services. Rand looked at the efficacy of incentives in getting people to participate and found that, in fact, the use of rewards and penalties will increase participation. It can be sometimes hard to distinguish between penalties and incentives, and in fact the rule defines a reward as the avoidance of a penalty. So it could be either way. Rand also noted that by just designing more comprehensive programs that are more aligned with the services that people want, you could achieve the same gains in participation without incentives.
What gets tough about wellness is that when you get in, it's a timing issue, right? So that's not going to have the immediate benefit that you might say a plan might look at and saying, hey, I'm really actuarial driven and I need to drive cost in a particular year. But most of the research will show pretty good ROIs and within kind of a 3-year period.
There are different rules, some of which are maybe evolving. So under ERISA, there is a general rule that prohibits insurance discrimination by health plans. So certain kinds of wellness programs that use incentives tied to the health plan premium or cost sharing are allowed to vary, what people pay for their health benefits based on their health status if it's through a wellness program that meets standards.
There's an expectation. I think when you talk to providers think employers have a role in supporting the health of their employees. The provider has a role. The health plan has a role. And so when you get that collaboration between the employer, the provider, and the health plan, that it's not, and the consumer itself has a role, right? So the surveys will support that everybody knows they have a role, including the consumer, in terms of managing their own health.